Obstetric fistula is a communication between the urinary system and the female genital tract and occurring, unfortunately, during childbirth. The main cause is obstruction of the blockage of the progression of the fetus on childbirth. And this could be prevented during the prenatal follow-up when the midwife or the doctor realize that the woman cannot deliver normally, and she should be referred to a center to have C-section. If not, unfortunately, when the fetus is, the baby is not able to come out, there will be a compression of the bladder on the previous bone, and this will end up with a fistula. You can have other causes of fistula that could be iatrogenic, meaning instrumental, during any procedure, endoscopic, surgical, in the pelvic area, meaning gynecological, urological, or general surgery, and very rare cases, but unfortunately prevalent in some places in the world, like in the South African region, what we call the traumatic fistula, due to violence.
So what does a fistula treatment consist of? I know surgery is part of it.
Actually, when the fistula is constituted, the only treatment is surgery. The surgery can be very easy in the beginning, but if anybody not skilled enough will try to do it, unfortunately, it can end up to be an incurable fistula because the complication of the first attempts. So normally, only people who have been trained to do it should start this kind of surgery. As I say, it can be very challenging sometimes, but it's very exciting and very, very rewarding if really we allow these women, very, very, very poor and sometimes very isolated in the community, to recover their dignity.
Actually, that's one of the reasons you are in Côte d'Ivoire, taking part in a campaign to treat women who have developed this condition. Talk to us about this campaign in Côte d'Ivoire. What is it and why is it important?
Last August, when we brought in Côte d'Ivoire 14 surgeons from 12 sub-Saharan African countries to operate on 180 women with very complex fistula cases in 5 hospitals, and that initiative end up with a high-level dialogue with the First Lady of Côte d'Ivoire, Mrs. Dominique Ouattara. And from there, we decided to have an annual work plan that will build capacity throughout the country and to allow surgeons in any single hospital to be able to take care routinely of the patient who is suffering from obstetric fistula. Bordeaux was the first part of this initiative for this year. We are developing capacity for them to be able to take care of the patient. So this is the first stage. So at the end of this year, the objective is to have at any center where we can do fistula surgery, having someone at least competent to do it. And from Côte d'Ivoire, we're going to scale up to other countries.
What is needed for the complete elimination of fistula in Africa?
Prevention to reduce maternal mortality and morbidity, number one, because if one mortality, you have 16 complications. So number two is to increase surgeries because it's very low. We do about, in sub-Saharan Africa, 2,000 to 3,000 fistula a year. Or in some countries, you have about 4,000 to 5,000 fistula patients waiting, and about 1,000 to 5,000 new cases every year. So the backlog is huge. So if we bring everybody on board, the surgeons, the urologists, the gynecologists, anybody serviceable, anybody who can be part of this and to contribute to increase the number of surgeries, will clean the backlog. And if you are efficient enough, we will have efficient prevention to not to have new cases. And not forgetting to have some strategies for social reintegration for those women who have been left behind for many years. They need to be more educated, to be economically independent. And in this regard, I think we can definitely think about eliminating obstetric fistula in sub-Saharan Africa.